to dissolve dry medicine in a vial and aspirate drug solution into syringe. Step 1. Sanitize your hands. Step 2. Take out syringe and needle from disposable bag, taking care not to touch naked end of syringe. Step 3. Put the needle on the syringe. Step 4. Aspirate solvent into syringe from the ampule. Step 5. Remove protecting covering from the cap of the vial. Disinfect the rubber cap of the vial containing the dry powder and medicine. Step 6. Insert the needle into the vial. Hold the whole unit upright. Step 7. Inject only the fluid into the vial, not the air. Step 8. Shake well. Step 9. Suck up as much air as the amount of solvent already in the syringe. Step 10. Turn the vial upside down. Step 11. Inject the air into the vial, creating the pressure. Step 12. Aspirate the total amount of solution. Step 13. Remove any air from the syringe.